Now to a coronavirus alert as we head into flu season. Mid-South hospitals are preparing for a surge in patients, not just of those with the flu, but those also battling coronavirus. WREG's Kwame Wilborn spoke with doctors who say they have more than enough tools to handle this possible influx of patients.
Local health officials say the second wave of COVID-19 has hit Shelby County as well as the rest of the Mid-South. Well, doctors over at Baptist Memorial Hospital say they are using the latest tools to stay within capacity.
It really plays into the idea of managing our resources, understanding what our patient needs are.
In Shelby County, the health department says the county has seen an average of 261 new cases per day over the last 14 days. Intensive care hospitalizations remain at 90%, with 21% of those patients being COVID related. However, as the colder months roll in, doctors are expecting those numbers to take a sharp increase.
The winter, colder months bring new challenges. People are closer together indoors.
Assistant Chief Medical Officer at Baptist Memorial Hospital, Memphis, Dr. Ashley Harris says the hospital has seen a slight increase in cases over recent weeks. He says the hospital has about 70 COVID-19 positive patients, but that number is still significantly lower than the summer months when COVID was at its peak.
I think we learned a lot about the disease itself since then. We understand more about how it's transmitted. We understand the PPE that's required to protect our staff and patients and families.
Due to this new understanding, Dr. Harris says he does not believe capacity will be an issue, thanks to a system that allows them to keep an eye on every bed in all Baptist hospitals across 3 states. He says this gives them the ability to quickly move patients to another hospital if needed. There's also the first FDA-approved drug used to treat COVID-19, Veklury, also known as remdesivir. The drug is said to cut recovery time by at least 5 days.
Everybody needs remdesivir, but certainly we are able to use it in a larger population of patients than we were when we initially had access to it because we understand it better.
Kwame Wilborn, WREG News Channel 3.